On January 24th, 2023, Lindsay Clancy from Massachusetts took the lives of her three young children and then attempted to take her own life by throwing herself out the second-story window of her home. She ended up permanently paralyzed. Now, Lindsay was charged with 3 counts of first-degree murder, and her jury trial begins in 4 days on July 20th. However, what makes this case very interesting is that Lindsay is blaming medical malpractice for the death of her children and her paralysis. She is alleging that the psychiatrists who were looking after her treated her with a dangerous cocktail of medications that led to psychosis and the events that unfolded. And so today I'm going to be breaking down this case as a board-certified psychiatrist, an expert in psychiatric drug side effects, and also as someone who sees multiple people with serious adverse reactions to psychiatric medications in my private practice on a daily basis. So let's jump into it. We're going to start with a news clip to give you an overview of the case.
Lindsay Clancy sat without emotion in her wheelchair during this pretrial hearing. She's charged with first-degree murder for the strangulation deaths of her 3 young children in their Duxbury home in January 2023. Clancy's lawyer is mounting what in essence is an insanity defense.
And an involuntary intoxication defense.
It's expected he'll try to convince a jury that Clancy was not criminally responsible, that she was over-medicated in treatment for postpartum psychosis.
From a human nature standpoint, I wouldn't want anyone to have to be in there to look at gruesome photographs of little babies slaughtered and cut up and butchered and autopsy photographs. No. But that's what they want to do. So that's part of a trial. We'll make a decision if she's going to have to sit there through it.
This trial is expected to last 4 to 6 weeks. Jury selection is slated to begin on July 20th.
Okay, so let's jump into some of the details of what actually happened in this case. And what I'd like to share with you off the bat is when you're assessing for involuntary intoxications, essentially a defense that the drug made you do it, you are always going to be looking for alternative explanations for the behavior. Now, in something like murder, what are the alternative explanations? Well, the person had a past history of aggressive behavior. Maybe they were abusive. Maybe they had problems with alcohol. Maybe they had severe unstable mental illness. All of those things could play into it. Now, what's interesting about Lindsay Clancy is she had none of these things. She had no prior history of severe mental illness. She had a few episodes of mood instability following the birth of her first 2 children. However, aside from that, she was a doting and loving mother of 3. She was a wife, she was a nurse, and she never had any of these problems. She didn't even take psychiatric medications previously. So essentially, the prosecution, who is going to try and pin murder on her, is trying to say that she was secretly a psychopath or something like that she was harboring these feelings and they were premeditated, and it just came out of the blue and no one expected that. I think that's actually a pretty weak case. And what I want to do with you now is actually go through the argument her lawyers are putting forward for her malpractice case. So let's jump into it. Okay, so this was filed at the start of this year. Okay, so we're going to bring here. So after the birth of her 3rd child, she went into an episode of postpartum anxiety and depression. Recognizing that something was wrong, she went and reached out to her doctor, Dr. Jennifer Tufts online, who put her on Zoloft. And then Lindsay experienced a severe adverse reaction to this. She did not sleep for 48 hours, had racing thoughts, worsening anxiety, and felt awful. This was a dramatic departure from previous sleep patterns and an obvious warning sign of medication-induced activation consistent with bipolar disorder. So something you're going to see about this case is that her current experts on her side are actually saying that she had bipolar disorder as evidenced by some mood instability that she had during the postpartum period of her 2 earlier children. And this can make sense because the case that they're trying to make is that she got put on these SSRI medications and they essentially triggered mania and psychosis. And if we come over here to the label of an SSRI medication, Zoloft, what we can see is this is already a recognized risk, that the drugs can cause activation of mania and hypomania, and that you should screen patients for any personal or family history of bipolar disorder, mania, or hypomania, so you're aware of this and you can quickly either avoid the medication or stop the medication if it's worse. Now, her defense experts are essentially making the case that that didn't happen. However, there are quite a few other things that can cause these problems, and I see them in my practice. These SSRI medications can be quite neurotoxic to people. It's not common, it's fairly rare. But quite frequently, I have people come in and they're exposed to an SSRI for a few days, and it causes a whole host of problems. They can have visual problems. Sometimes they get ringing in their ears. Sometimes they can have confusion and mood instability. It's almost just like a neurotoxic reaction that hits the brain. Now, a lot of doctors look at this as something called serotonin syndrome, but generally that's not diagnosed unless someone has a lot of like blood pressure problems and sweating and frank confusion. And so it's often missed, but you actually see these minor toxic reactions fairly commonly. And after you get one of them, you can have this fallout effect where for multiple months afterwards, they have nervous system instability, they respond poorly to medications, drugs make them worse, and essentially they can have mood instability and psychosis as well. And that's something that I'm not seeing in this document, but it's something that I have seen in a lot of my patients, which I know can happen. And just so you know that this isn't just me, we're back over here at the drug label now, looking at the adverse reactions that occurred in less than 2% of patients that were treated with Zoloft. And if you come down here to nervous system and psychiatric disorders, they observed ataxia, so that's unsteadiness walking, coma, convulsions, decreased alertness, lethargy, syncope. For psychiatric disorders, there was aggression, bruxism, which is teeth grinding, confusional state, euphoric mood, and hallucinations. And so these are all things that the manufacturer found during the clinical trials. And so the drug companies are also seeing the same thing. Now, jumping back over here, another thing that I want to show you is that when her dose went from 25 to 50, that made things worse. Now, in drug safety, we call that a dose response reaction. And so if you're feeling bad on a drug and you go up on the dose and it makes you worse, that's a pretty good sign that the drug is responsible for making you worse. And so I just want you to remember that, because what happens after this is very interesting. She goes back to the doctor, and the doctor essentially discontinues the Zoloft and prescribes a cocktail of medications for sleep. However, even after stopping the Zoloft and starting these other medications, she still has profound insomnia and distressing cardiac palpitations. Again, for me, this seems to be a sign that she had a toxic reaction initially to the Zoloft, and now it's causing some global problems. That's why you're having heart palpitations, insomnia. I know it's not in here, but she may have had some visual problems, some ringing in her ears, different things like that, all signs of a neurotoxicity. She ends up going back to the hospital and the doctor prescribes her trazodone for sleep, but that's not helpful. Again, once someone's had a neurotoxic reaction, they typically do not respond well to additional medications. Out of desperation, her mom, who is a nurse at a different local hospital, the South Shore Hospital, she contacts their perinatal behavioral health program asking for additional help. And that's where she meets nurse practitioner Paul, who prescribes Prozac. Now, here is why this doesn't make any sense. If you had done a proper history, you would say, okay, well, there's this dose-response reaction to the Zoloft that made her worse. I'm probably going to avoid drugs from a similar class. Remember, Zoloft and Prozac, they're in the same class of medications, SSRI medications. And so if someone's having a neurotoxic reaction to an SSRI, you're not going to expose them to another one, because that can further irritate the nervous system and make her worse. And so here's what they find happens afterwards. After merely 4 days on Prozac, Lindsay reports that the medications intensify her insomnia. She immediately informs her providers and the Prozac is discontinued. This was the second antidepressant that caused activation and worsening insomnia, a critical red flag for bipolar disorder the providers failed to recognize. Yes, bipolar disorder, but also drug toxicity. Afterwards, Nurse Paul goes on to prescribe, again, a cocktail of sleeping medications. So Ambien, potent sleeping medication, Remeron, potent sleeping medication, Klonopin, potent sleeping medication, and anti-anxiety med. Now, in most cases, you would expect this to work. You would expect it to put someone down. But as I've mentioned before, if you've had a neurotoxic reaction and you've destabilized your nervous system, people don't respond to drugs in typical ways. And so let's see what happens. Well, after taking these drugs, Lindsay experienced dissociation, perceiving the world around her as unreal, distorted, and distant. She's unable to determine what was real. She became disoriented, forgetful, confused, and disconnected from her own body. She was unable to drive and unable to be left alone. This is not a typical reaction to these drugs at all. This is a sign that someone is responding extremely poorly to medications. And that should be a clue to anyone looking after her that, hey, more drugs is likely not the answer to this person. This nervous system is not responding well to these medications. So after getting put on these medications, she ends up following up with another nurse practitioner about 3 days later who diagnoses her with bipolar and prescribes Seroquel. Now, most people would expect, hey, you've got the diagnosis right. Bipolar disorder, and Seroquel is FDA approved for bipolar disorder, along with a lot of other antipsychotics. Okay, we've got the right drug now. Shouldn't this work? However, look at what happens. After starting Seroquel, Lindsay's condition took a dramatic turn for the worse. She developed suicidal ideation and began experiencing what she describes as intrusive thoughts, which were auditory hallucinations. The voices said, I will not be the same. I want to die. She communicated her escalating internal turmoil to her husband, parents, and providers. She described her emotional state as emotionless and like a zombie, attributing this profound blunting to Seroquel. On top of this, she ends up losing 15 pounds, has no appetite, and is experiencing panic attacks and confusion, and has a lack of attention over several days. She becomes so frightened by the hallucinations that she calls the suicide hotline seeking help, but they don't hospitalize her because she doesn't have a plan on how she's going to kill herself. She does it again with Aspire Crisis Support. Again, they don't hospitalize her because she doesn't have a suicidal plan. Her husband then follows up with her and her nurse practitioner. Her husband is Patrick, and here's what he says to her. Lindsay is 10,000 times worse since she's taken this medication, and asked if they could get Lindsay off the medication and start from scratch to see what's going on. He asked if there could be some mistake, like using the wrong medications, and Nurse Joletta acknowledges it's possible, but despite this, she continues to increase the Seroquel dosage towards 400 milligrams a day. Now, this is just absolutely heartbreaking what is going on here, because the intuition of the husband and the intuition of the patient is correct, that these drugs are actually hurting her. You know, she has this initial bad reaction to the Zoloft, she's destabilized, and it's almost like every time she gets exposed to another one of these drugs, because she's had this toxic reaction, they're making it worse and worse and worse. I see this a lot in patients with protracted withdrawal injuries and bind. These are different adverse psychiatric drug reactions which cause essentially nervous system damage. And after they happen, every time you take another medication, it causes a quote-unquote kindling reaction, which is essentially further damage to the nervous system. Because once you destabilize the nervous system, additional drugs often make it worse. And so this nurse doesn't pick up on that. They have this kind of this sense that, hey, you know, better be safe than sorry. Let's just use more medications. And they end up increasing the amount of the drug. Patrick then calls the nurse's office to report that Lindsay had a devastating week. It was the worst day for Lindsay. She had horrible thoughts all day, auditory hallucinations every day, felt debilitated, not interested in anything, can't get out of bed. The hallucinations are now loud and continued all day, saying, I will never be the same. I'll never be me again. You are damaged. You'll never be the same. The only option is to die. So this is someone who is having a severe toxic reaction to medications at this point, and she's essentially being tortured. She goes on to tell her husband, I have thoughts of harming the kids. She also told her mother about these thoughts because she was in a psychotic state. She began to have paranoid delusions that people could hear her thoughts, and then she would be locked up in a hospital and have her children taken away. Now, this can be like a real stretch for some people, that it's like, okay, yes, you can be confused, you can have these adverse reactions, but at what point does it start to become like homicidal? And I've followed a lot of these cases. The one that comes to mind was, I think it was a California woman who was smoking cannabis, and sometimes this can cause these delirious type reactions. But I've also seen this in my own practice. You actually feel like you descend into hell. When you're in a state where your brain is dysfunctional and you have severe anxiety, you're constantly in a negative mood state, you haven't been able to sleep, you sometimes feel possessed, almost like possessed by a demon. And you hear these voices, and you start to hear voices that are saying, you know, the only way that you're going to get out of this is if you kill yourself or if you kill other people. And you can be completely consumed and taken over by these delusional, delirious, fever dream type thoughts. And so that's what happens. Shortly after this, Lindsay ends up being hospitalized at McLean Hospital. Now, this is Harvard's hospital. This is the best psychiatric hospital in the United States, supposedly. And the doctors there advise Lindsay to stop the Seroquel and the benzodiazepines, and they prescribe trazodone for sleep. And a few days later, Lindsay asks if she can go home because it's her daughter's birthday, and they allow her to go home. And potentially she may have gotten better at this point if she wasn't started on additional medications. However, she ends up seeing Dr. Goodhart from McLean, who speaks to her for only 10 minutes and offers her more antidepressants. They suggest amitriptyline to her other doctor, Dr. Tufts, who ultimately prescribes the amitriptyline to her. Now, again, this is crazy. You know, this person has had 2 bad reactions to antidepressants that are clear, you know, the Zoloft, and then also the Prozac, and then she was also on the Seroquel. And now they put her on another antidepressant, amitriptyline. And this really sets the stage for what happens next. Because after she starts the amitriptyline at 10 milligrams a day, she still doesn't get any better. And then Dr. Tufts, her psychiatrist, increases the amitriptyline to 20 milligrams per day. and that makes her worse. And this is the day before she ends up killing her children. And so this is kind of graphic now, but I want to read through this, and I advise you turn it off if you don't want to hear this, but this is what happens on July 24th. Lindsay wakes up severely depressed with suicidal thoughts. She gives her children breakfast. She takes her daughter to the pediatrician because she complained of a stomach ache. She goes home. She goes to the backyard with the children. They build a snowman, and they send a picture to Patrick and her mother. She begins to experience suicidal hallucinations all day nonstop. Later in the afternoon, the voices begin saying, "You should harm the children." Lindsay thinks about dinner and realizes that she hasn't prepared anything, and so she asks her husband about takeout. Now, this is like what the prosecution says. This was a premeditated thing because she told her husband to get out of the house and get takeout. I think this is like such a big stretch, in the context of everything going on, to make this case that she'd been secretly thinking about this for a long time. It goes on to say this: as soon as Patrick left to pick up the food, there was a loud, demanding, repetitious voice. "This is your last chance. Kill the children so you can kill yourself. This is your last chance. You have to kill the kids so you can kill yourself." Lindsay felt a force overcome her. Lindsay experienced command auditory hallucinations. A demanding, powerful male voice explicitly ordered her. She felt an overwhelming, irresistible compulsion to comply, entering a dissociative, dreamlike state where her physical actions felt utterly disconnected from her conscious volition. She perceived her body was just acting, and she was merely watching herself do it. She reported she had no choice but to follow these compelling directions. She described, "I lost all control. My body started acting without control on my part. I was just following commands." She then proceeded to strangle each of her children, uttering, "Go to God, baby." Following these acts, she undertook a severe suicide attempt, ingesting a substantial quantity of various medications, self-inflicting lacerations to her wrist and neck, and jumping from a second-floor window approximately 20 feet to the ground below. For our non-US listeners, that's about 6 meters. That is a massive drop. Lindsay suffers catastrophic injuries, including a thoracic spinal cord injury resulting in permanent paralysis below the sternum. That's why she was in the wheelchair at the start of this video. And she suffers multiple closed fractures of her cervical and thoracic vertebrae. Lindsay consistently maintains her actions were compelled by a hallucinatory voice, not a conscious decision, and expresses profound and enduring love for her children. I don't know anyone that could hear this case and not just feel utterly enraged by what happened to her. I mean, the senseless loss of life of these 3 children for no reason when it was so clear that she was responding poorly to these medications. I don't know when the psychiatric establishment will wake up and realize that you can't just keep on throwing drugs at problems. Sometimes the drugs make people worse. Sometimes you have to take them off them. You have to monitor them. You have to keep them safe. You have to admit that, hey, these drugs can make people toxic, and now we just have to wait for you to recover. But they never do any of that. There's this sense that more is always better. And to me, we're going to see what happens in about a week's time when this case unfolds. It'll probably be wrapped up within 2 months. But to me, right now, the most telling thing is that her husband, Patrick, is standing by her during this. Could you imagine being the husband? You've definitely had those thoughts, was this premeditated? But for him, the person who lived with her every single day and watched her go through this, if he is looking at her and saying, "This was due to the drugs, this was not my wife," to me, that speaks volumes. I'm going to be watching this case with a lot of interest because psychiatric drugs are certainly going to be on trial. And I think the cautionary tale in this is that, hey, more drugs is not always better. And so if you feel that you're getting worse on these medications, listen to your intuition, talk to your doctor, start thinking about coming off. And if you're really struggling about coming off, that's actually something we do. And so you can check the link below this video and you can learn about our practice. Thanks.